Hi everyone. I'm Wang from Peking University First Hospital, and I'm a dermatologist and a dermatopathologist, and I'm working on primarily on cutaneous lymphoma. It's my great honor to be here to have the opportunity to join the WCD. Cutaneous lymphomas are a heterogeneous group of rare cancers of lymphocytes. And lymphocytes are a type of white blood cells in our blood. And this lymphoma has a feature that it primarily involves the skin. So it starts from the skin, but the lymphocytes, I mean, the malignant lymphocytes can traffic into the other part of the body, including lymph node, peripheral blood. So it may cause very lethal effect to the patient. And cutaneous lymphomas are classified based on whether they are the cancerous cells are B cells or T cells. If the tumor was derived from T cells, it's called cutaneous T cell lymphoma. And if it's from B cells, it's called cutaneous B cell lymphoma. There are many different subtypes of cutaneous lymphomas. They all manifested differently. And in general, cutaneous T-cell lymphomas typically presents with skin rashes, presents with red scaly patches or plaques on the skin with itch. And cutaneous T-cell lymphoma in its early stage often mimics benign inflammatory dermatosis like eczema, psoriasis, atopic dermatitis, or other chronic dermatitis. So it is common that the diagnosis of cutaneous T-cell lymphoma is delayed, sometimes by years or decades. The diagnosing of cutaneous T-cell lymphoma is always challenging. For cutaneous B-cell lymphoma and other types of CT cell, cutaneous T-cell lymphomas, they often manifest as slow-growing red bumps in the skin. And in certain subtypes, like in diffuse large B-cell lymphoma, the bumps may grow rapidly. Uh, in general, cutaneous lymphomas have an indolent course, but in some subtypes of them, they have very aggressive behavior. And other than the skin lesions, cutaneous T-cell lymphomas also have a profound impact on the quality of life, especially in patients with advanced stages and in patients with a skin of color. It has impact on the emotional, social, physiological, and the financial well-beings of the patient. The etiology of cutaneous lymphomas is not fully elucidated yet. It's believed that the cutaneous lymphomas are a result of multiple reasons, and because they are believed to be derived from skin resident T cells or B cells. So the somatic gene mutations on these cells and environment-related epigenetic changes, as well as some infection-induced chronic lymphocyte activation, are believed to contribute to the onset of the disease, especially the bacteria Staph aureus. People found evidence that Staph aureus may promote the development of cutaneous T-cell lymphoma. Oh, actually, there's no global epidemiology study yet because it's a very rare disease. In general, it's a rare disease. According to previous epidemiology studies in North America, the incidence rate of cutaneous lymphoma is around 10 per million population per year. And the incidence rate varies with ethnics. The incidence rate in Caucasians is lower than that in people with darker skin. And in Asian population, cutaneous T-cell lymphoma appear to be more frequent than the cutaneous B-cell lymphoma. We have some upcoming new drugs in clinical trials for cutaneous T-cell lymphoma, including JAK1 inhibitors, PI3 kinase inhibitors, and new photodynamic therapies, new topical reagents to control the disease. But the treatment of late stage CT cell, cutaneous T cell lymphoma, is still very difficult. There is no cure for cutaneous T cell lymphoma yet, and cutaneous T cell lymphomas have very profound impact on quality of life. So there are some clinical approaches to relieve the itch, anxiety caused by this disease. And in our days, physicians realized that the treating cutaneous lymphoma needs a multidisciplinary approach, including dermatologist, hematologist, radiologist, and nurses. So the multidisciplinary clinic are more and more popular and required for in centers treating cutaneous lymphomas. But there's one thing that I need to point out, that the availability of the drugs varies in different parts of the world. Like in China, there's like several drugs that listed on the guidelines in North America, and these drugs, but these drugs are not available in China, like veranostat, romidepsin, and some new biologics like anti-CCR4 antibodies, anti-CD52 antibodies. And I know that there are also some drugs are not available in Europe. So in general, the global globally, the treatment for cutaneous T cell lymphoma and cutaneous B cell lymphoma the approaches are still limited, but a lot of studies are ongoing. Scientifically, actually, there are several important studies regarding the pathogenesis of cutaneous T cell lymphomas have been published in the past year, actually in 2022. There are several single cell analysis studies, including the one from our group. And these studies showed previously unidentified molecular features of the malignant T cells and their tumor microenvironment. And there are also several studies regarding the transformed CT cell published. The transformed CT cell have more advanced stages and a poor prognosis and a worse response to conventional drugs. And our group and others have found some uh, core oncogenic programs and cytogenetic drivers in transformed cutaneous T cell lymphoma. And these programs and cytogenetic drivers may serve as novel therapeutic targets in the future. Okay, so everyone, I'm honored to be here and to have the opportunity to join the WCD and see you all in Singapore.